Have you ever wondered why most primary care visits are only about 15 minutes long? In that short amount of time, physicians are expected to review your medical history, address your concerns, prescribe medications, document the visit, and then move on to the next patient. For many patients, that experience can feel rushed, but the reality is this isn't necessarily because providers don't care. It's largely because of how the healthcare system is structured. Let's talk about why these short visits happen. Hi, I'm Natasha, your care management nursepreneur. I help primary care practices implement nurse led, technology supported care management models that improve patient health outcomes while also generating sustainable revenue for practices. One of the biggest challenges in primary care today is time. And understanding where that time goes helps explain why care management is becoming so important. One of the biggest reasons primary care visits are short is patient volume. Many primary care physicians manage patient panels of 1,500 to 2,000 patients, sometimes even more. To meet the healthcare needs of that many people, providers often have to see 20 to 30 patients in a single day. When you divide that across a workday, the amount of time available for each visit becomes very limited. Another factor is how healthcare reimbursement works. Many healthcare systems still operate under a fee for service model, where providers are paid based on the number of visits or services delivered. Because of this structure, practices often have to maintain a high number of appointments throughout the day to remain financially sustainable. That naturally encourages shorter visits. Physicians also spend a significant amount of time on administrative work, documenting visits, updating electronic health records, completing insurance documentation, and handling other administrative tasks. In many cases, providers spend almost as much time documenting care as they do delivering it. That reduces the amount of face to face time they can spend with patients. Now, think about the reality many patients face today. Millions of patients are living with chronic conditions like diabetes, hypertension, heart disease, and asthma. Managing these conditions properly requires education, medication monitoring, lifestyle support, and regular follow up. That type of care simply cannot happen in a single 15-minute visit. And this is exactly where care management becomes so important. Care management services allow nurses and care teams to support patients between visits. They can follow up with patients, review medications, reinforce care plans, and help coordinate care across providers. This allows physicians and nurse practitioners to focus on diagnosis and treatment during visits, while patients receive the ongoing support they need to manage their health. So the reality is that short primary care visits are not necessarily a failure of providers. They are a reflection of how the healthcare system has been structured for many years. But as healthcare continues to shift toward value based care, we are beginning to see more team based models that support patients outside of traditional office visits. And nurses play a critical role in making that possible. If you're a nurse interested in learning how to build a care management business or partner with healthcare providers, I invite you to join my online community, Empower Care Academy. You'll find the link in the description.